Okay, we are good to go. People are hopping on. We are just now going live on Facebook. Some of you will see this on YouTube. Welcome, welcome. When you hop on, say hello to us. Our participant number is growing. That means we're good. Hello, guys. It's me and Dr. Scott Saunders today. We are manning the ship. Joe won't be able to join us today, but we're super excited to have you guys because we are going to be talking about type 2 just like we do every week. We are excited to be able to take your questions. So if you have questions, go ahead and start posting them in the Q&A on Facebook. Feel free to post those in the comments. We're going to do our best to try to answer as many of those live as we can. So welcome again. If you're joining us on Zoom, or if you're not, maybe you're on Facebook. You can register for this webinar at bartonwebinar.com. Free webinar. It's awesome with a live, real doctor, which is exciting.
Live, I'm not dead yet.
I won't
Reports of my death are greatly exaggerated.
I won't be the one answering your questions. He will be, but I will be in the background just kind of helping out. We're going to go ahead and just get started right away. Again, say hello. But we're going to start with a question that came in this week, as long as I can find it. Give me 1 second here.
So today we start off. So every other week we do just general diabetes, just the basics. So we call it back to basics, and this is what it is and what's going on. And the reason is because repetition helps a lot. You go, oh yeah, we talked about that, and now I get it, and that we talked about before. And so repetition is actually very useful because each time you learn it on a different level, especially if you're doing it. So if you have the diabetes solution kit and you're going through it and you've read the book and you go, yeah. So you read the book and then you start doing stuff. And then when you hear it again, you go, oh yeah, I've done that. Oh yeah, that works. Oh that. Okay, that's why that works. Okay, that. And it just helps you along your path. So we thought it would be a good idea, like every other week, to go back to basics. So we're going to start off with a few questions. Remember, I'm going to give the science behind it. I'm going to give, this is what's done, this is how it's done, this is what works, this is what causes diabetes. I'm going to tell you a lot of things that apply to generally to people who have either type 2 or pre-diabetes or whatever you want to call it. Insulin resistance is primarily what we're talking about. But it may not apply to everybody because some people have type 1 where they don't make enough and they're insulin resistant because they have autoimmune antibodies against their insulin. So for example, there's so many variants that I can't give you all the information for everybody. It's very important that when you get information that you see if it applies to you. And most of the general information can be done by anybody. Even if you have type 1, you could do the diabetes solution kit. That's why we put it out there for everyone, because that's something that everyone could pretty much do. But when people come back to us and say, gosh, I've been doing this for weeks and it's not working, then we go, aha, you need more information. You need to know why. So apply it to you. Don't expect that everything that I say is going to be specifically for you. It's not all about you.
Also, this is probably a good time to maybe do a disclaimer as well. So the information that we are presenting here, of course, is of our own opinion, of Dr. Saunders' opinion. You should work with your own doctor to determine if these things are right for you. Okay? So we got to throw that out there every time. So let's go ahead and get started. We do have a question that already came in. This is from Seth. I'm not even sure if he's on the webinar, but he had emailed me earlier in the week. He says, hi, Leslie. I started going through this cold experience this year in my hands and my feet. I was diagnosed with prediabetes. I changed my diet and lifestyle. I think he's saying I can change my diet and lifestyle. Is the cold foot related to prediabetes?
Oh, that's a good question. The answer is, I don't know. So cold hands and cold feet, what really is going on here? Well, your brain controls every inch of your body, the blood flow in every inch of your body. So when your blood stops flowing to your feet, that means your brain has squeezed down the blood vessels. Why? Well, either to conserve heat to your core, so either it's like colder in the environment or your core is colder. Well, why would your core be colder? If you started a program and you're eating fewer calories, one of the things that happens is you don't use as much brown fat to make extra energy, and so you're not making all that extra heat because you actually burn quite a bit of calories in just maintaining the heat of your body, maintaining your body heat. So when you diet, and this is why people tell you not to diet. Oh, don't do this because you'll get really efficient. It's okay. It's not a problem. But the answer to your question is, if you've changed your lifestyle and you're actually eating fewer calories, or you've cut out carbohydrates, your body might be using less calories to make heat. Then you start conserving the heat by constricting the blood vessels to your hands and feet. And yes, that's a possibility. How do you get around that? Exercise. Exercise is a great way to restore that circulation, because exercise opens up the blood vessels and starts the circulation going again. So instead of sitting around, try exercising. That's one way. Magnesium supplementation also helps. There's something called L-carnitine, which helps get the fat into the muscle cells so that your muscles can make more, use the fat. And then the brown fat can make it, which are modified muscle cells, to make more heat. So that's the coldness. There are other reasons, but if that's the scenario you gave me. Now, if your thyroid is low, people with cold hands and feet always go, "Oh, my thyroid is low," and that's actually, I don't know, probably rarely the case. It's less often than everybody would think. You know, our adrenal glands and metabolism have so much more to do than just the thyroid. And everybody thinks, oh, it must be low thyroid because my hands are cold all the time. It's not always the case. Sometimes it is, but it's not always the case.
That's very interesting. Okay, guys, those of you on Facebook, feel free to ask your questions there. I will be checking those as well. And we have a lot of questions already, so this is great. Those of you on Zoom, you can post those in the Q&A or in the chat, whatever works best for you. Hello, Grace. I see that you're on. No Joe's, she said. You know, he's just not here. He's with his wife. I'm not, they're out of state doing something. I'm not exactly sure what, but
I saw a picture from Tennessee, so he's somewhere.
They're somewhere. They're somewhere.
Somewhere.
And he left us. I don't know if I'd have trusted me, but that's fine. Okay. Let's see. Robert, hello. Can a person with type 2 diabetes progress to a type 1 diagnosis?
Thank you. Thank you. That is a very basic question. And what's really interesting about that is doctors will always tell you, commonly, it's very common because in medical schools, they're teaching that you start out with type 2 and you have insulin resistance, your pancreas is making a whole bunch of insulin, and then your pancreas poops out and you become type 1. That's probably not. That's probably a very simplistic way of the way it looks. But usually, what happens is you become so resistant to the insulin that your metabolism starts shutting down, and the pancreas, because it's putting out all this excess insulin, the immune system starts cleaning it up, and it, we think of autoimmunity as, oh, my soldiers have turned against me. The football team is going the wrong way. They're going towards the wrong goal. It's all, my immune system is fighting me instead of fighting the bacteria and all the other junk outside of me. That's not really the way it works. The immune system is the janitors of your body. They're the cleaner uppers, they're sweeping up everything, all the mess that you make, because you know what? Sorry that you're always making a mess on the inside too. And so as the immune system is cleaning everything up, taking out the bad cells, the dead cells, you know, they got to bury them somewhere. Um, and all these extra proteins, you got all this insulin around. There's a ton of insulin. And so you can make insulin antibodies. And so some people do get autoimmune low insulin and then start progress to a type 1 diabetic. Yes, it's possible. It's really not that common, but it is possible.
Wow.
It does happen.
Okay, very interesting. These are good questions. All right, we have, let's see, Edie. On a Facebook note I saw, it talked about the best sweeteners to use. Could you mention those?
Yes.
What are they?
You want to hear it again?
Yes.
Okay.
There's your answer.
You want to hear it again? That's it. That's all of them. I just told you about. Okay. So people go, oh, the best one is like stevia. The best one is this. The best one is that. The fact is, you kind of have to individualize it. Some people, not everyone, but some people are really sensitive to anything with the taste of sweet, will cause their pancreas to put out a bunch of insulin and makes them more insulin resistant. In that case, sweeteners down to zero, none, nothing, no sweeteners, no taste of sweet. I don't care if it's 0 calories. It's still not good for you. So I don't know if you're one of those, but I have had many patients who have had that problem, where 4 drops of stevia in their tea was all the sweetener they ever had, and they could not get normal. They couldn't lose weight. They couldn't get their insulin down. And that's all they were doing. So you have to be really careful. Sweeteners, if someone has type 2, sweeteners are often a problem. Any kind of sweeteners.
Also, this is a good time to mention that we do have every single one of our webinars, all 63 of them recorded on our YouTube channel. So make sure you go to Barton Webinar. Is that what it's called? Let's do this. bartonwebinar.com. Go to that website. It will give you a direct link to subscribe to our YouTube channel, or you can go to the YouTube channel and watch all of our videos where we talk about all of these things, you guys. It is this free, I don't even know, this free portal into tons of information. And we have a lot of people who go there. And
I went on there this morning looking for the link to get on to here today. And there's this big, it says YouTube. And so I clicked on YouTube, and it went to all lists of all these with the little pictures on them. And I hate seeing my picture on there. I don't know why. It's just,
what?
I don't know.
Oh, that is funny.
So I didn't watch any of them.
Oh, they're so good. And one other quick little tip, I have been going back through and not doing a full transcription, but kind of highlighting so that you can click on different times. Like say we talk about one of our products is CinnaChroma, and we talk about that at minute 12. You can click on the 12 minutes and it'll take you right there. So if you don't want to listen to certain things, or you only want to ask or find out an answer to, for example, good sweeteners, you may be able to find that where we talk about that. You can just click on it. It'll take you directly there. So go check those out. Lots of good information there. And we've really covered a lot of topics. Okay, let's move on. We've got more questions. Lots of questions here. This is great. Let's see. Luann is on from Ontario. Hello. And she has 2 questions here. I'll get to those. Let's see. Sani, I may be pronouncing that incorrectly, but I'm fasting and my blood sugar levels are down to 5.3. I've stopped taking my vitamins, turmeric, and CinnaChroma. Is this okay?
Absolutely, that's okay. Okay, the turmeric and CinnaChroma are helpers. They're something to help you, and the CinnaChroma has the list of ingredients in it are supplements that are common deficiencies. Most people don't get enough vitamin D and selenium and chromium and vanadium, which help you to use, all of which help you to use your insulin more efficiently. So you can lower your blood sugar, but also mostly get your insulin down to normal more easily. But that's just a helper. The real benefit is when you get when you're on the program, when you're actually doing like the phase 1 program and getting your insulin down with the diet. The diet is so much more important than the supplements. But supplements, maybe if you're deficient, you could get diabetes, all by itself. But anyway, the supplements are helpers. The diet is the issue. The food is the issue. I had a patient call me yesterday, and his test came back. He had a decreased kidney function. So I'm like, well, you're not at a rate of dialysis, but you know what? You're headed in that direction. And clearly you have type 3 or stage 3 kidney failure. And this isn't something to mess with. And he said, so what do I do? I said, stop eating, stop putting things in your mouth, because I know I've been dealing with him for 10 years. So I know this is an issue with him. And he goes, oh, so you want me to cut back about 50%? I said, no, cut it all out. He said, but my wife just made apricot jam. I'm like, no, that goes too. No apricot jam. Anyway, so, but those are the kinds of things. Yes, the diet's so much more important than the supplements. I agree.
It's good. All right. Our friend Krish is back. Let's see, Krish. Many say that type 2 diabetes is an inflammatory disorder. Uncontrolled type 2 diabetes causes many complications affecting various organs. As you have told us about CinnaChroma and Metformin in the same manner, they act in the same manner on the mitochondrial fat oxidation and lower insulin resistance. I want to share my experience and ask Dr. Saunders a question. To lower my blood pressure, I've been taking turmeric BP once every day, along with ashwagandha to reduce stress. Within 2 weeks, my fasting blood sugar dropped from 128 to 115. I'm not taking at this time CinnaChroma or Metformin with consent from my doctor. Is this beneficial effect? Will it also result in a reciprocal way of normalizing sugar metabolism and reducing potential complications?
Wow, yeah, that's a great question. Absolutely. Okay. Stress, remember we talked about this, for those of you who remember, that stress, if you want to go back and look at the old webinar on stress, it was great. We talked about how stress affects blood sugar. It's huge. In fact, some people get diabetes. It's only stress-induced diabetes, and they don't really have like a metabolic-induced diabetes. It's just stress-induced because the stress hormones make you resistant to insulin. And your problem is what? Diabetes type 2, insulin resistance. So if the ashwagandha and the turmeric lower your stress levels, then what that can do is make you less resistant to insulin. Your blood sugar goes down, and that's the primary thing you want to do anyway. So yes, that's a great way to do it, and yes, it will improve. But remember, still the diet's the most important, even though you're on the stress reducers. Those are good and those are helpful, but don't assume the helpers are, like my patient yesterday. Don't assume the helpers are the everything.
Okay, this is good. Hello, Glenn. Welcome. Just started on the magnesium spray, which, if you are not familiar with that is one of our newer products. You can find more information at bartonwebinar.com. I read that I should use 30 to 50 sprays. Is this per day or at one time? I was told I should start iodine, but I can't read the plastic tube to know how much to fill it. I see some lines on the tube, but I don't understand what line to fill at. Are you able to help with that?
Yeah. Okay. The iodine, I have some here. You have the iodine. The iodine is this one right here.
You guys, I don't even have these products yet. I gotta go get these.
I do.
I live 15 minutes from Joe, and I don't even have them.
And so the iodine is a fairly low dose, so you can't overdose on it. And the ideal is around 1 dropper a day. So you just fill the dropper, put it in water, drink it down. Or some people fill it with the dropper, put it right in their mouth, and swallow it down, and that's fine. And the magnesium is a spray, and it says 30 to 50 per day. And so you just spray it on your body all over, and you can rub it down or just spray it on, let it dry. Like after a shower or something like that. Um, and if you count to 30, if you count to 51, you're not going to overdose. It's okay. Or if you do 29, that's not going to be a problem either. But the idea is to like allow it to absorb all over your body and not just put it on one spot. Like when people are doing their hormone replacement creams, they just like do that, and that's all.
Okay. Krish says no apricot jam. That's good. Okay. Is it okay to take another version of iodine, and then this is from Tina. Can I take another version of iodine? I also use magnesium as a spray.
Yeah, iodine is so basic. There's two different kinds: iodine, iodide. Either one, you absorb iodine, your body makes it into iodide really quickly. Some of them say, well, you have to get both iodine and iodide, so they make this iodoral pills. It doesn't matter that much. You know what? When you take up iodine, your glands they just love it, and your thyroid gland will hold on to about 8,000 micrograms. That's about 8 milligrams of iodine a day. And so, not a day, but a total, it stores that much, 8,000 micrograms. And you're taking these, 100 micrograms or whatever doses. So, no, it's fine. Any form of iodine that you get is fine.
Okay. One thing you had mentioned is, for example, I have a magnesium that I would mix with water. And if you take too much of it, you'll know because you'll be in the bathroom for a while. That doesn't happen with this kind of magnesium. Is that correct?
Oh yeah, when it's on your skin. Well, that's part of the reason for putting it on your skin is some people are so sensitive to it that if they take it into their intestines, it gives them diarrhea. So if you spray it on your skin, they used to call it magnesium oil. That was you just get a magnesium. It's not really oil. It's water. It's just magnesium. It's just magnesium salt in water. It's a saltwater solution. Simple.
Good. Tina says magnesium is good for leg cramps. I think I mentioned this on a webinar another time too. I was having a lot of back pain just because I was running and I bent wrong and who knows what I did. And Dr. Saunders was like, you need to take a bunch of magnesium. And it just worked so quickly and so fast. I felt so much better. So magnesium's kind of like that wonder supplement for me. It just seems to help with a lot of things. So all right, let's do some more questions. Again, welcome to all those new people. We have quite a few people on today. These questions are wonderful. If you have questions for Dr. Saunders, type those in the Q&A or on Facebook. We will do our best to answer those while we are live. So here we go. Let's see. Luann, welcome. Does CinnaChroma cause interactions or affect my bowels? I get some diarrhea only once in a while, but not every day.
Okay. Anything can affect your bowels. Everything can. There isn't anything in CinnaChroma that should affect your bowels. Vitamin D is absorbed very rapidly. The selenium, chromium, vanadium are in tiny microgram quantities, not even 1 milligram, which is really a small amount. There isn't any magnesium in it. There isn't anything in the CinnaChroma that should cause diarrhea. But you know what? The fact is you can react to anything. They have things in pills called excipients, which are just fillers, because you have to dilute it in something. If you think about, 200 micrograms of selenium, you can't even see that. It's this small. And how do you put that in a pill and make sure that every pill has the same amount and all of that? Well, they just mix it with these excipients, and then they fill the pill, and they know that statistically they're going to have that much in the pill. You could react to those, and a lot of them use a magnesium stearate, which is a fatty acid with the magnesium. And some people have been known to react to that. So the answer to your question is yes, it's possible, but I don't know of anything in there that would do that.
Okay. That's good. Margaret, hello. I know that foot tingling is a possible indicator of diabetes. However, it is also a symptom in menopausal women. Should a menopausal woman be concerned if they have such a symptom?
Yes. The answer, okay. Um, the tingling is a sign that the nerves aren't working right. Much of the time, that's because of a lack of circulation. So, in menopausal women, when they get these uh, changes in their circulation, if you've ever heard of a hot flash, a hot flash is dilation of blood vessels, and all the veins and arteries, all over the body, they dilate, and you go, "Whoa, it's hot in here." And everybody else is going, "No, it's not hot in here. It's just you." Because the blood vessels dilate, and your skin senses that heat from internal is different from the external. It's like, wow, it's really hot, but it's not it that's hot. It's your temperature senses in your skin are saying it's hot because of the dilation of blood vessels. So at the same time, you can also get constriction of blood vessels, and that's where you're talking about, like with menopausal women getting tingling, cold tingling feet. And a lot of menopausal women are given thyroid for that. We talked about that a minute ago because, oh, my feet are cold and tingling. Oh, yeah, you need circulation. Here, take some thyroid. So it's the same kind of thing. Exercise helps a lot. Magnesium helps a lot if it's circulation. And then if you really have a circulation issue, that's what we have Nervala. That's what Nervala is about. So numbness, tingling, those are signs that if you're not getting enough circulation, if the problem is diabetes or associated with diabetes, it's a really good idea to take Nervala and get that circulation working so that your nerves function properly. That's totally different from the hormone issue of menopausal women, though. That's you work with the hormones. It's a different way of handling it.
I think we have quite a few new people on today. Most of you are familiar with Barton Publishing and you already know about the Diabetes Solution Kit. If you do not, you'll want to go to bartonwebinar.com to find out more information about that. It's a very inexpensive, it's a book and you can either get it printed or you can download it and have it right away. And Dr. Saunders, this is what he uses with his patients. So they go through phases, a lot of his eating. He talks about some supplements, exercise, etc. There you go. You can see him holding it.
See, I got a
Good
book.
information. Thousands of people have had their lives transformed by this. So if you have not seen it, heard of it, you want to purchase it, you want to look at it, bartonwebinar.com. Okay. Let's see, Luann. Okay, in a survey, you mentioned a certified diabetes coach. Do you have a coaching certification program? She'd love to become a coach for us in Canada. So that's awesome. Luann, you can send me a message about that at leslie@bartonpublishing.com. Okay. Thank you so much. And let me keep moving here. Keep the questions coming, guys. This is good. And a lot of these are new people that I haven't seen on here before. So this is good. Margaret, are people with type A blood more susceptible to type 2 diabetes due to the AC1 gene?
Okay. Okay. The answer is yes and no, or maybe. It's not that easy because there are so many interactions. But the answer of the genetic issue is yes. Is it blood type? Um, Not specifically blood type, but people who are from certain areas, have certain type of blood, and they also have predisposition to getting diabetes type 2. So it's not because you have that blood type, it's because you have that genetic background. So people who are from areas where they have periodic famines, for example, commonly in the South Pacific Islanders, a lot of the Native Americans have this genetic makeup that they are predisposed because they get insulin resistance really easily because every time they eat, they store everything, and they're really good at storing stuff so that they can eat and store all of that really well, and then have extra when there's not enough. So it's actually makes you more resistant to famine. You can survive famines longer than those of us who don't have the gene, but still, yes, it's genetic, and it's a dietary thing also.
Okay. What about those with O blood type? That just came in as well.
Yeah, O blood type. I don't know. Uh, I don't know if the type specifically corresponds. I just can't. All I can say is I don't know.
There is a book out there, I think, called Eating for Your Blood Type. Is that
Eating
right?
for your blood. Eating for your
So,
blood type. Yes.
okay. I would
Yeah.
like to actually read that. I'm curious about that. So I think we
Our dietitian that worked in my office for a while, she swore she used that a lot, and she swore it worked really well. That it was pretty consistent. That a vegetarian like type O's would not do well as a vegetarian, but type A's would, for example. And she was a vegetarian, and she says, those type O's, they can't be vegetarian. They got to have some meat. So
interesting. Okay, that's
yeah.
good. This is fun. I love to learn about this stuff. So okay. More questions. Oh, good question from Krish. Does the herb elderberry increase blood pressure?
Oh, I don't know if it does.
Hmm.
I don't. I don't. I don't have any information on elderberry blood pressure connection.
Okay, another question from Krish. If I succeed in bringing my A1C to 5.5, should I still continue to take Nervala when symptoms of peripheral neuropathy going off?
Yes, the Nervala is completely separate from the A1C, and the A1C 5.5. That's really good. 5.0 is like the optimum. 4.5 to 5.5. So you're in the good range. Um, the so at that point, you're doing really well, keeping your sugar controlled really well. But if you still have symptoms of tingling, numbness, it takes a lot longer for nerves to heal than for your metabolism to heal. Like I said, I've had people who were like with hemoglobin A1Cs of 11, in a matter of a couple of months come down to 5, by fasting and broth cleanse or something like that. But it's you're not going to heal your nerves that fast. The nerves take a long time. They can take 6 months or even years. In fact, the studies that I looked at that we formulated Nervala with, they were 6-month long studies to see any difference at all. So yeah.
Okay, that's good to know. Okay, Keith, hello. 3 weeks into the solution program, but in the morning, he's waking up, or he woke up with a reading around 90 to 100. But even eating nothing, it rises to 125 and stays there. At night, it falls to 90 to 100. What's happening?
Oh, good. Okay, good work. Okay, so for those of you who don't know, he's in phase 1. And phase 1 of the program is a ketogenic diet. It's very well organized so that you have 20 grams of carbohydrates a day. And so you choose with the foods you want, but you're only eating 20 grams of carbohydrates. And during that time, because you're not getting that sugar, then your insulin levels start dropping down. And so 3 weeks into it, if you're getting normal readings, 90 is a perfectly normal reading. So that's really good work. So the question is, gosh, when I first get up in the morning, it's 90 to 100, but then it goes up to 125. I haven't eaten anything. What the heck? What makes the blood sugar go up? It's normal. You have in your pancreas two, not opposing, but two hormones that work together, but in opposite ways. So when the blood sugar starts going low, then you make a hormone called glucagon. Glucagon starts going up. And when the blood sugar gets high, then you make a hormone called insulin, and insulin starts going up. So you have this kind of thing going on. So as your blood sugar is dropping down, you start making glucagon, and glucagon is telling your liver, hey, make some more sugar. Come on, we're a little low here. Start making sugar. So then the liver starts doing something called gluconeogenesis, sugar new genesis to make. So making some new sugar out of nothing. Well, no, it's not out of nothing. It's out of protein mostly, but and other organic acids that are around. So the gluconeogenesis raises your blood sugar, even though you haven't eaten anything. It's okay. That's good. It's actually really good because that's allowing the liver to use up all the extra, well, because it first uses the glycogen, which is the starch that is stored in the liver, extra sugar. Don't worry about it. Good work. Keep going.
Okay, this may kind of piggyback here. This is from Adadege. I'm not sure how to pronounce your name. I'm so sorry. If I try to avoid carbs or lower too much of the carbs, my body becomes shaky. What's happening there?
What's happening there is hypoglycemia. So hypoglycemia is low blood sugar, and it's not comfortable, and it can cause dizziness, nausea, vomiting, shakiness, poor focus. People go, gosh, I just can't focus. Tired, weak, fatigue. All of those kinds of bad symptoms could be from hypoglycemia, low blood sugar. But that could be relative, because if you have this, we talked about this last time with the brain when we were talking about type 3 diabetes. The brain might not be getting enough sugar into it because the number of glucose transport proteins is diminished. And if that happens, and you're normally sitting at a blood sugar of 200 and you drop it down to 100, which is pretty close to normal, that's just normal. In fact, optimal is between 70 and 90. So you drop it to 100, which is still not quite even in the optimal range, and you're going to feel like weak and fatigued and I don't feel good, because you have that relative drop in blood sugar. So you know, I've dealt with this in many ways, and it depends on you as an individual. Some people go, oh, as long as I know it's okay, I'll just power through it and I'll go lay down and take a nap and I'll be fine. Other people say, I can't stand it. I got to do something. So if you can't stand it, you got to do something. The nice thing to do is eat some almonds. Raw almonds are great. Eat some carrots. Raw carrots are great. And you know, munch on almonds or raw carrots. What that'll do is it'll give you something to put into your blood to get some blood sugar up, but it won't like people say drink orange juice. Your blood sugar goes through the roof, and then you release a whole bunch more insulin, and then it drops down again. Then you're chasing blood sugar all over the place. Whereas if you eat like some almonds or carrots, then it'll kind of have a gradual rise, and it'll stay up, and you won't have that. Now, having said that, go back. If you have that kind of an issue, go to the type 3 webinar, and I explained very carefully why hypoglycemia is a good idea. So then you can watch that and understand why your brain needs that periodically.
All right, very good. Geraldine, I have peripheral neuropathy in my feet very bad. I currently take Lyrica to control the pain and sensations. Can I get off the Lyrica, and is there something safer that works as well?
Okay, so lyrica is a GABA agonist. It's a neurotransmitter, GABA. It kind of like benzodiazepines and Neurontin, gabapentin, all those. All it does is control the sensation, so it kind of suppresses the sensation. It doesn't fix your nerves at all. So ideally, what you want to do is to fix the nerves, and the nerves are fixable. The farther along it goes, the longer it takes to improve. And I've seen some that after years haven't even fully improved. They can get a little bit better, but you know, nerves are quirky that way, and we don't know everything. You know, we think we know everything, but we don't. So we do the best we can. So the Nervala has the benfotiamine alpha lipoic acid that's known to improve nerve function. When people are really bad like that, I give them shots of vitamin B12. It's not something that a pill is necessarily as good, because you can really only absorb microgram quantities anyway. So shots do make a difference in the case of vitamin B12. And then you don't have to take lyrica. Lyrica does not make your nerves better. It only helps you feel better. So if you say, well, I'll just stop the lyrica and I'll put up with the numbness and tingling or the pins and needles until and take the Nervala or whatever until that improves, or whatever else can improve the circulation. So using heat and massage therapy, and there's light therapy now that has been shown to actually work pretty well. There's certain my son just yesterday told me, I think it's 450 nanometers, a very specific light that turns on the mitochondria. And so you can do light therapy. So there are various things you can do, and the lyrica is really only to relieve symptoms. And it's not really to help your nerves get better.
Okay. Henry asks, is it true that metformin causes cancer, and why lots of medication is being recalled?
Okay. Metformin. I think the metformin actually, because of the way it works on the mitochondria by preventing sugar from being used, it blocks the enzymes. There's actually more than one, it turns out. I was just doing some research on this with my son. That there are a couple of enzymes that are blocked from that allow you to use sugar. It increases cyclic AMP, which tells your body, hey, use fat for energy. So then you can use fat, but it also slows down the mitochondria. So you can build up something called lactic acid, because that lactic acid can't get into the Krebs cycle to use for energy, and it builds up and builds up. And that can damage the liver, and it can damage the muscles. And so there's a lot of lawsuits on that, and there's a recall on some because of that. And there was a metformin drug that was the same type of drug that was taken off the market because it caused too much. It was too strong, caused too much lactic acidosis, and then a larger number of people got that problem. So no medicine is safe. All the medicines we take are poisons. Even antibiotics are poisons. Everything is a poison because it's supposed to be. That's what makes it work. It has to act on a receptor and block a receptor or stimulate a receptor, which is exactly what poisons do. So if you get too much of it, yeah, it's going to cause a problem. But here's the thing about cancer. Because of the way it works, it also blocks cancer from using sugar for energy. And cancer doesn't use fat for energy very efficiently at all. So it can't grow on that. So because of the way it works, there are actually some protocols out there, and a lot of oncologists are putting their cancer patients on metformin so that it will prevent the growth of the cancer, because it can't use the energy function very well. So about causing cancer, I don't know specifically if it causes cancer, but I know it's used against cancer.
Okay, interesting. Okay, let's see. Martha has a question. Welcome, Martha. Recently started the CinnaChroma and turmeric. Always take them after eating. One of them is causing burning in my stomach for about 5 minutes. I overproduce stomach acid, and I take medicine for that. My questions are there any suggestions for helping with the burning? Will either of them affect my urine or bladder? Thank you.
Oh, good question. Okay. I can have some theories about this, but I don't know exactly. But you've given enough clues that I have an idea. So let's say you overproduce acid and you have a kind of a chronic gastritis or areas that are irritated in your stomach. And you take the turmeric, And the turmeric BP, the BP is biopter or piperacin, piperacin, which is from black pepper and can cause burning in your stomach. So the black pepper, BP, black pepper, Barton Publishing. Oh, I didn't know that. So the turmeric BP with the black pepper could cause burning in whatever areas are irritated in your stomach, and that for about 10 minutes. So that's a possibility. So just as a side note, just something to look into that most doctors don't do. Find out why you make extra stomach acid. It could be something called histamine intolerance, where you're missing an enzyme called DAO that blocks that breaks down histamine, because histamine causes excess stomach acid to be produced. So look into that. That might be an issue that is easy to resolve if that's what it is.
Okay, it's good. All right, here's a question from Facebook. Brian says, I have diabetic neuropathy. I have pain and numbness in my feet and hands, and I take 9 gabapentin, 8 tramadol, 8 paracetamol, and 1 duloxetine, and a dulaglutide. Maybe 1 me a week, but still pain. I live in the UK. Thank you, from Brian. I forgot to mention that he also takes 4 metformin as well. So I think he's looking for help.
Oh, okay. Brian, okay, you need help. So there are several things you need. You need to know why. You need to know how your pancreas is functioning. You need to know all about your insulin resistance. You need to know if you have antibodies, if you have autoimmune kinds of problems. You need to know about your circulation. So you need to have ultrasounds, for example, of your arteries. You may have had that before, and you may know a little bit about that. The circulation, both the venous circulation and the arterial circulation. And it would be really good to take Nervala. Nervala is the alpha lipoic acid and benfotiamine that help to repair the lining of the blood vessels to improve the circulation. Well, anyway, the benfotiamine improves the lining. The alpha lipoic acid actually is for an anti-inflammatory. The most of the medications that you're taking are just to relieve symptoms. They have no benefit for improving your diabetes or making any of this better. Your nerves are not going to improve on those medications. They're just going to get worse and worse and worse and worse. So the way to do this is to find out what the problem is. Start getting some tests done to find out what's wrong, and then start on a repair process. And a good, just basic repair process is a ketogenic diet. Get the diabetes solution kit, start doing phase 1, and continue on phase 1 longer than you would expect, because you don't just want to get your insulin down. You want to actually start repairing things quicker. And the ketogenic diet, ketones help the nervous system to repair, because it's a low octane fuel. Like sugar is a high octane fuel. And ketones are low octane fuel. Fat is more low octane fuel. You make less oxygen free radicals when you burn fat, and it's kind of slow burning. So a program of repair is what you need, instead of relief of symptoms. All you have talked about, all of the things that you're talking about, are relief of symptoms, and what you need is to fix the problem. So find out why.
All right, that is good. Okay, a couple more questions here. We have, let's see, Tina is asking, what are the best fruits to eat? My doctor said I can have any fruit in moderation.
Okay, fruits are great. Fruit contains all kinds of nutrients. It's really, really good, but just stick to the 20-gram carbohydrate rule at first. And when you get through with phase 1, when you have several months, ideally, of a normal blood sugar. Your hemoglobin A1C is below 5.5, and everything is looking good. Then you can start on phase 2, start adding in fruits in moderation, exactly what your doctor said. Excuse me. The best fruits are the ones that are low in sugar, and that would be cucumbers, peppers, berries, strawberries, blueberries. Those tend to be lower in sugar, as opposed to all of the what are they called? Tropical fruits, pineapple and oranges and bananas. Those are really high in sugar. So, just so that you have an idea of what's relatively high in sugar compared to low in sugar. Yeah, tomatoes are low and apples are high.
Okay. Let's see. Okay, so Krish mentions some food additives, diacetyl, and some other food additives that cause insulin resistance, and they result in obesity and diabetes. Assuming that this is true, why does the FDA not ban these chemicals that are used as preservatives in various food products?
Wow, good question. Okay, I want you to vote for me for FDA, and then I will go through research and figure it out. No, the FDA is people mistakenly think that the purpose of government bureaucracy is to protect them from all those bad companies and bad things out there. But really, the government bureaucracy, the purpose for the government bureaucracy is to protect the business. And it generally protects business in every way. In fact, if you look at all the wars, well, we have people going out and shooting other people, and it's really all about protecting my business. And then you have the FDA has a purpose. Who runs the FDA? Well, those are the people that become vice presidents in drug companies, and then have this revolving door. The purpose for the FDA is to protect the drug companies from competition and other things, from natural ways of doing things, right? So the food additives are things that they're going to look at it and they're going to say, well, this is relatively non-toxic. It's only going to hurt about 20% of the population, so we're okay with that. I don't know. Go figure.
Okay, you had mentioned to Martha about having her DAO enzyme tested. Can a family doctor order that test?
Oh yeah, anyone. Well, it's not available everywhere. I've had trouble getting it. I've ordered it a couple of times, and the local lab and the labs that my patients have gone to have said we can't find this anywhere. I know that you can get it online, and it's ordered from Europe, and I forgot which country it was from. I think it was Germany. That you can order it. You order a kit, and then you get your whatever blood draw here, and you send them the kit, and then they give it to you. So I know you can order it online. I don't know if a doctor could order it anywhere.
Okay.
I haven't been successful.
Okay. Margaret says, should we avoid oats and oatmeal? Last question.
Oats and oatmeal.
Should we avoid them?
Grains generally are not a good idea. And that includes breads and cereals and rice and corn. And we like to live on grains, breads and cereals. I spoke with a vegetarian once, and as I was talking to him, I said, "So, but you eat a lot of vegetables, though?" He says, "No, I hate vegetables." I said, "Wait a minute, you're a vegetarian?" He goes, "Yeah, but I don't like vegetables." I said, "Well, what do you eat?" He says, "Well, I like fruit, so I'm eating fruit, and then I have pasta, and I have rice, and I have cold cereal, just about, with almond milk, for just about every meal." And I'm like, oh, "That's terrible! What a terrible way to eat grains and nothing else." So, generally, grains are not a good idea, including oats and oatmeal, if you have type 2. Not a good idea.
Okay. I also find that I sometimes have problems if I do have oats, if they aren't actually gluten-free oats, I will have trouble with them. So, something to think about too. Okay, that's it. We are done, you guys. This was fun. Lots of good questions from all of you. Again, thank you, Dr. Saunders. Is he not the bomb? Like, we gotta, this,
The bum.
the bomb. No, I am from South Dakota, so I do have an accent. So maybe that did sound funny. That's possible. It's snowing here in South Dakota. It looks like a white Christmas day, actually, is what it looks like here. It's actually really pretty. But anyway, every week here, 12 noon Central. Make sure if you haven't registered for the webinar, bartonwebinar.com. Come with your questions last week or next week, excuse me. Invite a friend. I believe we're going to be talking about cholesterol next week. So that will be very interesting, and type 2. So we want all of your questions as well. So again, thank you guys. Y'all are awesome. And we will see you next week, Tuesday, same time, same place. Bye.